Don't forget to record, sir. There. Thank
Okay,
you.
I'm recording it. Okay. Okay, let's start the first class. Okay. The first class is actually about introduction to human factors and ergonomics in three main domains. Okay. Physical ergonomics, cognitive ergonomics, and macroergonomics. Okay. So for the first meeting, I would like to break it down all your knowledge about what is ergo, and we try to build it slowly one by one, and until all of you know like wow, ergo is actually really another world of in industrial engineering. Okay. Okay. So basically, uh, this is actually the definition, okay, of the human factors and ergonomics. Let's go back to the definition of human factors and ergonomics. Okay, this is the definition by IEA. It's actually International Ergonomics Association, the biggest ergonomic association in the whole world. Okay, and then they always have a conference every 3 years. Okay? This year, actually, it was supposed to be in Vancouver. I submitted four or three papers. I forget. Four papers. Yeah, four papers. There, it was actually online. And you know what, ma'am? Often I presented at 2 a.m. in here because it's a Vancouver time. The same with the Maela and other students. And then, but you met actually the god of ergonomics, actually the top of the top ergonomics in there, okay, in Vancouver. And then in 2024, it will be in Jeju Island, South Korea. So hopefully, we can actually travel there, and then we actually can meet, some of the top professors. All of my professors in Taiwan, they always attend. You know what? Because it's always every 3 years. Okay, and then this is the definition. Okay, ergonomics, or another term we actually know about human factors, is actually just scientific disciplines, okay, concern understanding of interactions among humans and other element of systems. And this profession applies theory, principle, data, methods to design in order to this one. This is the final goal: optimize human well-being and overall system performance. Okay, again, so the biggest goal is actually to optimize human well-being actually and enhance the system performance. And then in ergo, okay, for two of you, okay, basically there are three main domains. We have to know that ergo is actually consists of three. Okay, the first one is actually physical ergo. Okay, the second one is actually cognitive ergo, and the third one, people usually forget about this one, is actually macro ergonomics. So basically, there are three main domains about ergonomics, and in order for us to be an ergo expert, we have to understand these three main domains. But of course, it's quite difficult and quite rare to find someone expert in these three things. Okay, but usually people good at two, maximum. But yeah, I'm trying to make a balance. Okay, but now I think it's time for me to publish more into physical ergo. Okay. Okay, so in the past, when we know about ergo, nowadays we would like to go to ergo in Industry 4.0 or even Industry 5.0. Okay, so in the past, we always say like, oh, ergo is about dealing with human differences, dealing with human limitations, and so on. And the output usually is just the assessment result, guidelines, and the standard. But now we are not thinking about in that direction anymore. We are thinking in this direction. The new one is actually we would like to enhance human capability. How we can enhance the capacity of a human, instead of saying like, oh, it's limited to this one, limited to that one, limited to that one. But how we can try to expand our capacity or our capability. Okay, then we also talk about the joint design human technology. This is actually a very common in macroeconomics. Again, you know what, in the industry 4.0, we always talk about enhancing productivity, reducing the cost, advancing the competitive advantage, and so on. Okay? But the ergo, we actually have a lot of things that we can do in here. Now let's go to the first domain. Okay, today I will go to those three domains, but hopefully you know what, everyone will feel like, oh, this is actually the one big world of ergonomics. Okay, in physical ergo, oh, William, this is actually, it was me like how many years ago, 6 years ago perhaps, like I was quite thin that time. And you can see this is actually what class is this? I think this is human motor control class or biomech, I forget, like that class. Okay, this is actually force split. Okay, this is actually the force split, and this is actually the camera. And we this is actually just the preliminary. Okay, but later on they will attach some sensors on my body. Okay, oh, so on physical ergo, we know about that, right? At the beginning, usually people study about ergonomics. Actually, we know about physical ergonomics. Okay, what people know about ergo, especially for MS student, for MEPIE, they only know, oh, sir, we only study about the chair and table. No, you know what you know about ergo? It's beyond that. You know what? It's not just about the chair and table. You know what? After this one, you will know. Okay, so it comes that some applications in here is like the guidelines, the standard, for example, NIOS, okay, the anthropometrics, ergonomic assessment. We do RULA, RIBA, CMDQ, Nordic, and then the goal, of course, is to enhance the safety and health, and then also enhance the productivity. In the past, we always dealing with this one, right? Dealing with physical differences and also limitations. Now let's just go to this one a little bit deeper. In physical ergo, you know what? We know a lot of things about MSD, right? We always study about MSD, and so on. Okay, but again, basically MSD, okay, it's actually started from these three things. Okay, the repetition. You keep repeating, clicking, you keep doing things, although that's actually ergo design or like ergo friendly, but you keep repeating doing that, the repetition is actually quite high. It goes to the discomfort, then eventually it will go to musculoskeletal disorder. Okay, the second one is actually posture. But posture, you can divide like awkward posture and sustained posture. Okay, for example, awkward postures, of course, like if you sit and then like with awkward posture, some after several times, then it will go to discomfort, and it goes to the musculoskeletal disorder. But again, another one is actually sustained posture. Okay, if you buy like a very expensive ergo chair and so on, if you sit there for 8 hours, without standing, without stretching, again, it will go to the discomfort and musculoskeletal disorder. The third one is actually the contact stress. Okay, this is actually I complain a lot to the former dean, Sir Rex. Okay, actually the contact stress. I think Mom often knows that the table in our department, is actually like a sharp, because it's actually sharp, and then it goes to the contact stress actually like a, because it makes me discomfort, after working for 2 hours in IEMG department. It's like, oh, the table is actually the thing that I hate, because it actually, you can see the contact stress is sharp like this one. Okay, so if you buy a table, buy something like a oval, so it will be, it'll be good for you. The same thing with me for the mouse. You know what? When I use a mouse, I use this one. Do you know what is this? It's just a sponge, sponge wrap in the wrap in the towel, so no need to make it, because this one makes me, this is soft, I liked it, and then I feel I don't need to buy like a crazy expensive things for ergo
But sir,
devices.
there's a
I know. Yeah, I know, but I don't like that one. It's not it's
okay.
not soft enough. This is so soft, man. I mean,
Okay, okay.
I also have that, with the color, with purple color and so on. But after several times, I felt like no. The sponge is actually much better because it's so soft, and then it's so cheap, and I just wrap it in a towel like this one, and then yeah, I work like that one. So no need to be expensive for ergo. Okay, so the idea is like this one, like repetition, posture, and contact stress. Okay, so those three, you know what, it will go to the MSD. Okay, this is a physical ergo in general. Now, this is just kind of like a glimpse. I think all of you has, two of you know about this one already. So in order to do some kind of like physical ergo study, okay, it's better to show this one. Okay, this is actually a flow. That you need to show perhaps to the readers. This is actually one suggestion that I give to Ma'am Gumasik. No, Ma'am, I think it's better for you to have like a flow and so on. So this is a flow. Okay, for usually for doing the physical ergo. Up to you. You do it Nordic or CMDQ. Okay, those two are actually quite familiar. Okay, we start with which body part you feel like actually a little bit uncomfortable. Okay, this is the Nordic. Okay, and another one, this is the CMDQ. Okay, the two of these questionnaires actually quite powerful for identifying which body part actually they actually feel uncomfortable. Okay, and so on. Then we evaluate either the questionnaire, right? We tabulated those things and so on. Then we do some kind of like assessment method. Okay, assessment method, either we do RULA, RIBA, NIOS, and so on. Okay, either we do this is actually a quick ergo assessment. But now some physical ergo, they do some kind of like so many devices, like you attach EMG, you attach the force plate, your body markers, and so on. Okay, so there are so many type of typical assessment in here. Okay, the methods that they use in the physical ergo. Then they actually calculate the level of MSD, and usually people will try to do any kind of correlation analysis, okay, between the this one, the CMDQ, and the Rula-Riva score, and so on. Okay. Okay, so those actually that one of my students from Thailand actually joined. Okay, so Tanatorn is actually, this is here. Okay, and so on. Hi, Tanatorn. Sawadee krap.
Hello, doctor.
Okay, okay. Okay, so this one, okay, after the methods, okay, then it goes to the musculoskeletal disorder, and then with this one. See, can the risk be accepted? If cannot be accepted, we do some kind of like ergonomic intervention at the redesign and so on. Okay, if actually that it cannot, it's actually can be accepted, then just that's it. It's done. So basically a simple thing like this one. Okay, and don't worry for this one, for even a simple physical ergo study, there is one journal called Work. Okay, the Work journal, Work. The name of the journal is Work. Okay, I'll show after this one, after finishing this presentation. Okay, this journal is actually still accepting like I would like to say conventional method, like a quick assessment using Rula-Riva, NIOS, and so on. Okay, but in Elsevier journals like Applied Ergonomics, IGI, usually it's quite difficult for us at this point to publish only using the quick assessment like this one. But Work is actually still fine, can accept those things. Okay. Now this is actually an example. Okay, the result of this one, right? Result of NIOS or Nordic. This is actually the Nordic. I think, yeah, this is Nordic. Okay, so from 74 participants, you have to show this one. Okay, this is a very typical standard, for doing the physical ergo. Which body part they actually feel, discomfort. Okay, and so on. Then the next thing after that one, before doing Rula-Riva, NIOS, and so on, we have to identify what are the tasks, because for each task they have their own value. For example, Rula score in this one, receptions of chickens. This is actually in the slaughter. Yeah, this one, risk of slaughterhouse workers developing work MSD in different organizations. Oh, this is still good journal, IGIE, and it's 2020, still new. And then do you know why this one is still publishable in this journal? Because they actually show workers in the slaughter, chicken slaughter house. Okay, and they actually identify so many things that start from the beginning until the final one, and the final one, and they actually collected many respondents. And although it's actually a simple work, but the idea that they highlight in here is actually quite beautiful. Look at how many, look at how many tasks in here. Usually we only do one task, right? For example, we do like cleaning toilet tasks. We have one Rula score, one Riva score, and so on. But look at this one. How many tasks? There are so many in here, and they actually identify. Because the workers usually for cleaning, for example, this one, cleaning chicken breast. I think the workers in here will not be the same with like this one, packing or waiting. I think this, they have a different problems, the workers in here and the workers in here. Okay, so and they actually highlighted in a very nice table and so on. Okay, so even just a simple like this one, we have to know what's the value or what is the contribution of the study. Okay, it's so details and it's pretty beautiful. Okay, this is just a simple method. I think everybody knows about this one in the BSK. This is one example, the Riva or the Rula or the NIOS and so on. Okay, and then this is actually that the intervention that this study did. Okay, the intervention is actually the job rotation. So they actually try to rotate the workers. Okay, and let's see what will happen. With the MSD score and so on. Okay. But don't worry, we will also talk about the job rotation, job enrichment, job enlargement, in job simplification in the macroergonomics job design. Okay, so in here, the intervention is actually they did some kind of macroergonomics intervention instead of the physical. Okay, instead of like making the position a bit better and so on, they actually make an intervention using the macroergonomics. Okay, and so on. Okay, don't worry, I will talk about this one later. What is job rotation and so on. Now, this is actually that another study in IGIE 2020. This one, prediction of work-related MSG in the meat processing industry using the statistical model. It sounds very simple, right? The title, right? But it's not that simple. Look at this one. See, they always try to what? Identify first, right? The typical physical ergo study that without equipment. Okay, this is ergo study without equipment. It's actually like this one. They always show which body part. Okay, they got the problem. Okay, the MSG, discomfort, and so on. And after that, they will do the some kind of like analysis or assessment, either the RULA, RIBA, they do psychosocial individual questionnaire, and so on. Then they actually make some kind of like statistical analysis, and then they do the intervention. Usually that's a very typical study in physical ergo without equipment. Okay, or like just do the quick assessment like RULA, NIAS, RIBA, and so on. This is actually like the result of that study. Okay, again, usually you will show this typical table. Okay, this is actually quite common, or like I would like to say a standard table for showing the MSG. Okay, and so on. Now we go to a little bit advanced. Okay, now like a little bit more into like a 2021 typical of study that people nowadays in the physical ergo, they try again. At the beginning, people in the past, they'd always talk about limitations and assessment and so on. But now people actually talk about enhancing the capability of a human. If in the past, for example, 32 kilograms is the maximum and so on, but why people can lift 40 kilograms, 50 kilograms, and so on? How can we actually enhance, the power of the human? That's why there is one thing is quite famous, actually, exoskeleton. Okay, exoskeleton is actually quite new in the 2021. Okay, and another one is actually, but this is cognitive ergo actually, virtual reality and augmented reality. I think, I don't know, Mom, often you have kids, right? You buy HMD. I think one day, especially for kids, a male usually. Okay, for a male actually, they really like use the HMD, and it's not that expensive actually nowadays. The HMD, but you will have a problem with the I would like to say the visual discomfort, after wearing you will face visual discomfort actually now. Okay. Again, the goal is still the same, actually, to enhance safety, health, productivity, and satisfaction, and so on. Now, this is it. More little bit again, when we do physical ergo, is actually either we do quick assessment or either we do with the advanced equipment, and this is actually one of those. Okay. This is the wearable chair. Okay, I think Mam Gomasing is doing this one, but it's still about the acceptability. It's okay. At the beginning, people do acceptability, it's fine. But in advance, people usually check, the muscle activations. In here, for example, you check the hamstring, quadricep, tibialis anterior, and or gluteus maximus. They will check the muscle activation, in here, and they would like to see whether it actually can reduce the stress or can reduce the activation, I would like to say. Okay, and this is the typical study. They put the marker, okay, and so on, and then they do the gait analysis. This is actually the force plate to see the ground reaction force, okay, and so on. Okay, don't worry. Today there are so many new terms, perhaps for Mom Offit and William, but I will go in details every week. Today is actually like showing all the things that what we will learn in ergo. Don't worry. For example, oh sir, you talk about what gluteus maximus, tibialis, and then don't worry, it will be on the 8th week or 7th week, and so on. Don't worry, it will be one by one. Oh, what is the gait analysis? Oh, don't worry, it will be on the 7th week. Today is actually to show all the things that we will be discussed, okay, in this class. And this is a typical study in the advanced physical ergo that using the equipment. Okay, so usually the subject, we wear I would say the attach a marker. Attach a marker, and it's not just about the marker. Look at this one. There is a black one in here. This is actually the EMG, or actually surface EMG, I would like to say, because it will show the muscle activation. In here is definitely latissimus dorsi. This is serratus anterior. Yeah. So basically, and here is actually rectus abdominis. This is okay, the pelvic. Okay, and so on. So basically, like we attach, okay, those things into the human. Okay, and then another one, we have actually surface EMG, because this is the muscle in the surface, right? Because that's why they call it surface EMG, the muscle in the surface. Okay. We also attach, for example, this is EEG. Okay, the brain wave. Okay, the EEG and the brain wave, and this is actually the skin conductance and also heart rate. Okay, it will show some kind of like a graph, you know, that of your you know, for example, you watch you know what, a movie, and then you attach this one, and what will happen with your, you know what, heart rate, with your skin conductance, with your brainwave, and so on. So this is a very typical study that you know, nowadays people go into this direction. But don't worry, after this pandemic, you know what, I will buy some of this equipment. Okay, some of this equipment I will buy skin conductance and HRV. This is hindi mahal, you know, for this is not expensive for this equipment, but of course for the this one is very expensive for the motion capture, you know, and touch. Oh, this is actually almost impossible, but I think LaSalle has that one. But let me try to negotiate with them whether we can make a research collaboration and so on, because so far I don't see any publications from you know what, from motion capture, or I don't know, you know, UP has the how I'd like to say, master program in sport biomechanics, and they actually have this equipment, but let me check whether they have published something related to this one. Okay. Okay. Now this is another new topic. Operator 4.0. See, it's very new, right? New term, operator. It's like industry 4.0. If the industry is 4.0, then the operator should be 4.0 too. They can look at, see, control operator, super strengths, you know, using the exoskeleton like this one. Healthy, you know, we have attached devices, okay, and on the body, and also smart operator and so on. Okay, in these two, we will talk during the usability. I will talk it next 2 weeks. The third week we will talk about usability. Okay, next 2 weeks we will talk about that one. For this one, for the exoskeleton, we will talk at the week 7 or week 8. Okay. Okay, so basically this is the shift. Okay, that what will happen nowadays. People in Ergo, in the past we always just deal with the physical limitations, cognitive limitations, and so on. We just make a standard and so on. But now look at this one. Enhance people capabilities. Okay, enhance the satisfaction, employee commitment. Okay, see, look at this one. We will talk about next week job design. I know William is not working yet, so perhaps it's not fun for you, but for me and Mom Offin, I'm so excited to talk about job design. But perhaps the recorded video I will not upload it, because we will talk about so many things about our working you know, place. Okay. So those are all the things that perhaps in a physical ergo. Okay, physical ergo either with equipment or without equipment. If without equipment, there is, you know, you can see the flow like some kind of like a standard. You know, how people publish in a 2020 or 2021. You know, if we don't use any equipment. If we use equipment, okay, there are also several standards and scenarios that we need to do. Okay. Now we move to the second domain. Okay, cognitive ergonomics. Okay, actually my master is actually physical ergo. I did physical ergo, and for my doctoral degree I did cognitive ergo. But it was just coincidence that when I came to the Philippines, I became so macro ergo. So I think, yeah, I don't know, it's just a coincidence that I keep shifting the direction. Okay. But still in ergo. Okay. So in here, we talk about visual displays, we talk about situational awareness, we talk about mental workload, we talk about human-computer interaction, usability, okay, and so on. So, so many people, especially from psychology, we also talk about the same thing in here. And then same, we actually dealing with the cognitive differences and also the limitations, okay, for the cognitive ergo. Now, let me show it to you some of the domains in the cognitive ergonomics. First one, symbol. Okay, the symbol in the human-computer interaction in here. Okay, as you can see, look at this one. This is like a dentist. Okay, when you go to the dental clinic, check the icon. It's very interesting that they have so many icons in here. You know what? But you know, it's so funny that from one country to, for example, the manufacturer is actually from Japan. I tested to the dentist in here, and they say like, I don't know what is that. You know, so then there must be a problem if they don't know what is that one, right? Okay, so if there is an icon in here, see, so many icons here. They don't understand that it means there is a problem. William, you drive? You drive a car? Do you drive? You have driving
Yes, sir.
license?
Yes, sir.
If you go to your car, if you look at all icons in the car, do you understand all?
Not all, sir.
Not all, right?
But
so not all, right? Not all the functions you understand what are those functions, right? So that is still an issue too, in the icon, okay, and so on. So, and then why I'm interested with this one, okay, with human-computer interaction, it's just because you don't need. It's very different from the advanced physical ergo. Advanced cognitive ergo, if you have the experience or if you have the idea, even just one computer, you can do great publications. Even you only have laptop. Okay, in the past, my professor trained me, like, hey, one day you will not have those advanced equipment, I tracker and so on. And because he told me that I built that one for almost 40 years, of I had all those things, but one day, you have nothing. You only have computer. What can you do? If you only have computer. So he actually trained me, to do studies. If only using computer, we can still do so many things, even just with our PC and so on. One of those is actually this one. Okay, so now look at this one. The icon of in the the icon in the accident, for example, in here. Why the icon is like this one? Like why Taal is like this one? What is for example, why is it like this one? Let's this one bawal like this one. Why is like this? Okay, so selecting the icon like this one is very interesting topic. For example, okay, I always go to the beach and the ocean. I always take make sure to see the tsunami icon or warning. In here there's so many. Wow, even just in this one, selecting one icon, for a warning sign is actually a very nice topic that we can do. Or, if you don't know, it's like selecting the icon to represent the school. Go to Mapua website. There's so many icons, right? Like that one. And perhaps later on we will ask why IEMG is like that one. Why the icon of IEMG like that? Why the icon of mechanical engineering is like that one? What's the basis? Okay. And then when you see this one, is it effective? Is it good? People will understand. For example, if I don't show this one, tsunami warning signs, okay? Oh, William, which one you like? Choose one. I would like to know what's your favorite. Somehow I want to know what's your favorite. Everything is different, right? In here, right? See, it's different, right? See, it's different. Which one you like?
the second one, sir.
Second one. Okay, which one? Second, which one? This
On
one?
the left, sir. Yes, sir.
This one?
Yes, sir.
Bucket. Why this one?
Sir, it's shape more like a wave, sir. Than
Really? Not like
instead.
not like a Halloween, and so on. For me, it's okay. There is no right or wrong in this one. This is a human's preference. This is what I'm doing. Like this one is cancer engineering. We will talk about that on the fifth week. This is cancer engineering. I'm talking about your preference and so on. Okay, Mamofin, which one you like? I'm curious.
Topmost right side.
This one?
Yes. Because
Why?
of the tree.
Because
I
of the
just
tree.
like the tree.
Oh, okay, we should like the tree. Okay, see, that's the beauty of ergonomics, because even in this one, you will see so many different perspective and so on. For me, I like someone like running. Actually, for me, I prefer someone run and like this one, because this one for me it sounds like Halloween. This is like a beach party for me. I don't know. So we can have a different that's why we need to test it. Okay. Same thing, okay, for vegetarian, for Muslims, for Jewish, when we design an icon for the food. I mean, everything is the same, right? I mean, the idea is that one the same, but which one we prefer? The design is, there's so many design that we like, like which one is better? That design or this design and so on. Okay, the same with the Buddhism. If you Tanator, you're Buddhist, right? So are you vegetarian? Anatorn? I don't know. I don't think you're vegetarian. Okay, but for my friends,
Again, please, sir.
You're Buddhist, right? You're a Buddhist. So are you vegetarian? Not really, right?
Not really. At
in my birth month only.
Oh, in your birth month only, you only become vegetarian. Okay, okay, I understand. Okay, but okay, the same, right? In the vegetarian, like there is a label like this is vegetarian. You know, if you go to Taiwan, it's very common, you know, to see the color is usually green. Yeah, it's actually green too. Okay, and so on. Okay, now we also talk about this one learning curve. Okay, in the week 6, perhaps, you know, we will talk about learning curve and subjective mental workload. Okay, so learning curve is something like this one. Okay, you know, the completion time, okay, for someone doing the same task is actually can be explained in an exponential function. What's that mean? For example, okay, remember, you know, William, when the first time you know, learn how to park your car, you know, it took you like how many 2 minutes, for example, you know, for you to park the car. Okay, but after the second trial, the third, the fourth, the fifth, you know, and so on, it will be like flat, you know, be flattening like this one. It'll be much faster, much faster, and much faster, and so on. Okay, and those you can actually describe in a learning curve. Okay, you can actually make a mathematical model of that one, of the learning curve. Okay, but again, you have to define what is the, I would like to say, what is the task. For example, the task is actually parking a car. Okay, okay, parking a car, and then the second task is actually, for example, what's the difficult in the for example, the car, what's usually changing the oil. Can you change the oil by yourself? Yeah, I can do it by myself. You know, for example, it takes you know what, it takes longer time at the beginning, but after that it will be much faster, and so on. Okay, so you can actually describe in a learning curve. Not just about that, not just learning curve, we also can do the mental workload. Okay, and one of those is actually quite famous. We will do the NASA TLX. Okay, we'll talk this one during the learning curve week, you know, on the 6th week. Okay, Mom, I think you know about this one, right? NASA TLX. NASA TLX.
What's TLX? Sorry.
NASA TLX. No.
No, not familiar.
Okay, so perhaps this is
NASA
new.
as in the
Okay, okay.
face?
Okay, perhaps this is new. Okay, don't worry. I will. Okay, no. Okay, William, you know about this one? NASA TLX? No. Okay. See, it's still in the middle. You know, after this one, I will go to macro, and you will like, oh my God, Ergo is so big. You will know like, oh my. Usually for me, 11 weeks. Last term, I don't know. Every time when I ask Mom Gumasing or Mom Bores, you know, or yeah, two of them, when I ask them, how's that one? It's like I could not finish all the things that you know, is quite interesting for us. So it's never ending journey for Ergo. Okay, this is NASA TLX. Okay, this is actually for measuring the mental workload. For example, Mom, often, you know what? If the, you know what? If the requirement of the PhD is the multiple choice exam only, okay, and then another choice is actually publishing 2 SCI journals. I mean, the workload is quite different, right? I mean, the mental workload, right? That is the idea.
Very, very different.
Yeah, very, very different, of course. You know, like that is, you know, that's why, for example, you know, there was one day when I feel like I don't know, my parents usually say, oh, why your face is so, you know what, you know, focused and it's so frustrating and so on, because I told them it's like, oh, because I write the paper. Every time when I write the sentence, it usually I get angry easily. Okay, but there was a day like when I only did the model, did the statistical analysis using the SPSS or Minitab. You know what, I feel happy and so on, because it's just the short click and then you're tabulating the table. It does not, you know, require a lot of a big workload. So that is actually why we can measure using this one, mental workload. The workload, okay, or the subjective mental workload. Okay. And one of the I would like to say tools, very famous tools that I think every cognitive ergo researchers worldwide use this one, is actually the NASA TLX. Okay, it consists of 6 dimensions, ma'am. This is like AHP actually. Exactly, like if we know AHP, NASA TLX is exactly like AHP. Okay, but they define into 6 dimensions. Okay, mental demand, physical demand, temporal demand, effort, performance, and frustration level. So don't worry, we will talk about this one in details. Okay, later on you will know that for example that later on you try to compare, you know, the jeepney driver workload. Is it the same with the pilot? You know what, perhaps, you know what, the mental workload of the jeepney driver is actually much higher than the pilot, because they have so many crazy things, and
This is very interesting.
oh yeah, this is very interesting, ma'am. This is very interesting. This is actually like you can do in so many different things. Either this is actually what, surgical endoscopy. I think this is a dentist. Yeah, endoscopy. No, endoscopy. No, this is not a dentist. This is for medical worker. Okay, definitely for the doctors. Okay, we can do so many different things. You know, test into the, even testing the professors. You know, teaching what, teaching OR or teaching research method. You know, is it the same? The mental workload, we can actually measure that one too. For example, William, you know what, attending my class or passing the calculus class, which one has a higher mental workload? You can show, you know, to the
Sorry, question. So what would be the, how would be the, what would be the process? They just have to fill out,
okay, okay.
I mean, answer on a rating scale?
Okay. You want to jump to week 6? Okay,
No,
let
no,
me
no,
jump
I'm
to
just
week 6.
curious. Is it a rating scale similar to a survey questionnaire?
Yeah, it's like AHP.
Okay.
Let me show it to you after finishing this one. Okay, I have the software to show this one. Okay, we can try once, and at least you will like, oh yeah, that's a very interesting topic and so on. For example, that's why, you know, I would like to show this one. For example, a dental surgeon compared to like to the, you know, compared to the, how you say that, normal dentist, you know, to normal dentist. You know, for example, you only have one patient, you know, in one day. For example, a surgeon, the workload of one is actually perhaps really high compared to doing like the repetitive in the 4 different patients. You can tell the people why the higher, why the payment is actually higher, because of the mental workload is actually higher, something like that one. Okay. Oh, this is the virtual reality. Don't worry, this is eye tracker. I'll buy it. It's but not the expensive one. The one that I will buy, it's around how many, around I think less than 200,000 pesos. I think 150 something. I'll buy this one because I need to buy one quite advanced equipment. You know, eye tracker. It will detect your, you know, the movement of your eyes. You know, the pupil size. You know, when you feel stressed, when you feel excited, your pupil size is actually bigger. You know, you don't realize it's actually getting bigger. But if we die one day, the pupil size will not, you know, will not move. You know, when you know, right, when someone pass away, okay, usually when the doctor, to make sure, they will check the eyes, and they show the light, you know, the, if the pupils get bigger or lower and so on, then the person is, it means that the person is still alive. If it's just stuck there, you know, it's just stuck there, then the person perhaps passed away already. So the, not just for that, the number of the blinks, you know, the movement and so on, you can actually detect using this equipment. Okay, so one day we also talk about in the visual display like this one. Now we go to the third domain. Okay, remember today is actually about those three domains, and I would like to, you know, open all the things that what will be discussed in the whole 11 weeks. Okay, don't worry about no assignment, you know, for this class. Just come in and be happy. Okay. And then for the third domain is actually macroergonomics. We will talk about participatory ergonomics, specific training, teamwork, job design. You know, we actually talk about that one. Okay, job satisfaction, job commit. I'm sorry. Organizational commitment. We also talk about those things in here. Disaster is actually under the macroergonomics. Wait. And then the goal, of course, the same. You know, in his the safety, health, productivity, satisfaction, employee commitment, and so on. Okay, so we talk about the socio-technical system. Okay, perhaps this term is actually quite new for everyone, but this is not new. You know, macro ergo is being introduced in almost at the during the early 2000s. So as the third domain, because people don't talk about the physical, people don't talk about the cognitive, but people talk about the human and the environment of the socio-technical system of the human. So that is actually the third domain. You know, it comes. So this is it. See. Hendrik is actually Professor Hendrik is actually the, I would like to say, the one, you know, the first perhaps that talks about the macroeconomics. See, the optimization of organizational and work system design. You see that talk about the personal, technology, environment, and the how it interact each other. Okay, so it talks, for example, when it comes to the this one, it talks about what consumer behavior. Also, it goes to the macroeconomics, okay, because it's actually the interaction of the human technology and also the environment, and we actually try to elaborate those things into the, the focus of Ergo is always human, right? And then one of those thing that we need to consider is actually the technological and also the environment and the interaction and so on. This is an example for a topic in macroeconomics. I will talk this one next week because I really like this topic, but somehow yeah, I don't know. I just feel like to discuss this topic. Okay, we will talk about the job design. Okay, we talk wait, simplification usually is not that thing that I would like to discuss. I would like to discuss these three: rotation, enrichment, and enlargement. Okay, job design. Okay, job design consists of usually only these three. Okay, for example, enlargement. Okay, Mom Offin is also a part, aside from the faculty, she's also the auditor. I would like to say the how you call that, ma'am? The accreditation
Correct,
coordinator.
auditor.
Yeah,
Auditor.
accreditation coordinator and so on. Okay, job enlargement. Okay, William. Okay, one day when you enter the job, sorry, the job out the workplace, okay, a new company and so on, you will face the job enlargement. Don't complain. It's a standard thing that we always face as a human in the organization. We always want, what is enlargement? It's actually an extra thing. For example, okay, our main job, for example, me and Mom Offin, of course, to teach and do research. Okay, but for example, our enlargement, for example, for me, my enlargement is like, oh yeah, we have one project, write project research proposal, sorry, project proposal, and so on. That is one enlargement that you need to do. Okay, for example, enlargement is actually you learn another new skills in organization. Okay, it's common. Okay, but the problem, if you have so many, so many enlargement, you have no time to do that. The main is actually you break down. So that's actually that's the problem usually, that the people from MEPIE usually, they actually like, oh sir, I have this one, I have that one, and they don't give me extra salary for that one and so on. But I told them like, hey, of course, at the beginning, you will face enlargement. It's a common thing, and don't complain. No matter what kind of job, you will face enlargement. But the problem is if you don't have enrichment. Enrichment is actually like a extra pay, or extra pay. It's like you go to higher ranking. Okay, you go to higher ranking. For example, from the you become a supervisor, you become manager, and so on. After how many years you become there, and what is the step to go to up there? That is what we call job enrichment. Okay, and not just you go on the top, but your salary is actually getting higher. Because it was quite funny that someone, one of my MEPI students, like, oh sir, my ranking is higher, but my salary is the same. And then I told him, it's like, hey, it's a fake. The job enrichment is fake. I mean, what for? You go like, oh yeah, now I become a supervisor or blah blah blah. And I told him like, hey, what about your salary? I mean, the salary should be higher, right? If the salary is the same, then it's just a fake job enrichment. It's a fake job design. I told him like that. And then 2 weeks after that one, he changed his job to another company. It's so funny. And then the good thing we want to study here is talk about the job organizational commitment. See, you satisfy, and actually you get a commitment to your either university, your workplace environment, and so on. Okay, we will talk about this one. But the tools usually in his one is actually definitely structural equation modeling. And another one, job rotation. But job rotation at the beginning, this one is actually for physical ergo. Job rotation, okay, it's famous in 1950 something when they actually rotate the workers. Okay, usually workers in the construction, okay, they do like digging process, they do like repetitive work, so they will have a musculoskeletal disorder. Okay, so you remember the first study in the physical ergo, the intervention is like you rotate the workers, right? They actually rotate it, but the problem with rotation is like the skill they actually need to learn, the rotation, they have to be able to cover the rest of the skills. But here is actually one study. It's actually job rotation for nurse is actually quite famous for nurse, when they actually have a rotation, and when they rotate, okay, they actually have a better job satisfaction, and which eventually they have a strong commitment to the hospital. Okay, so rotation is actually quite good for the nursing, one of the studies. Okay, so this one is actually we can apply in so many, not just in the not just in the industry, but also in the hospital, you know, and so on. Okay. We can actually do this one, but it's very rare. For example, in academic job rotation, for example, Ma'am Offin suddenly become the head of the registrar office. I mean, it's weird, right? I mean, it's very rare, you know, in academic. Usually we only face enlargement and enrichment. Okay, so that's the thing. Rotation is very uncommon. The similarly, the medical doctor, the doctor rotate, very weird, you know. But nurse, yes, I believe for nurse, yeah, it's quite common. Okay, and so on. This is the dentist, I think. This is one, yeah, third offer among dental hygienists in the South Korea. So in here is actually they measure the job stress, the fatigue, okay, job satisfaction, and this one, turn offer intention, okay, whether this person actually quit or not. I published one study about dentists during the COVID-19. Actually, I thought that they actually like you know what, I add another one is like personal protective equipment, and another one is actually like a workplace problem, you know, whether you dislike your coworkers and so on. But the most, you know what, the best one that the predictor offer intention is actually the salary. Even during COVID-19, that for me, like, wow, I thought it's PPE and so on, but when I, after, you know, getting the result, I asked some of them, they say like, no, we, I mean, we were well trained for that one even before COVID-19. They told me like, I mean when we were in the school of the dentistry, you know, we studied all of those things, you know, but if we have a more salary because of that one, you know what, they will have less turnover intention, you know, and so on. That's why, you know, they try to usually like the problem, for example, in the Philippines, the nurse get out, right, or they want to resign, right, for during the COVID-19. And then when I watched the news, like, oh yeah, now I understand, you know, like they have to have extra incentive or extra money, you know, otherwise that they will quit their job if they you know, keep facing like that one. Okay. That's why so many you know, nurses like you know, flew to the Middle East, to Australia, US, and so on. So because of this one, you know, the job design. Okay. This one, another one, external work opportunities. Wow, very interesting. Yeah, compensation. See, that's a good one. Work pressure, you know. See, so this is actually the thing that perhaps you know, we can do. For example, I don't know, among faculties or among high school, you know, I think Ma'am Masing will do for the public high, you know, public university, you know, what you know, what enhance their commitment in the school and so on. Oh, another one is actually well-being, right? We talk about the well-being of the a worker or of the person of you know, the subject. So in macroergonomics, we also talk about the consumer behavior. Okay, so that's why, you know, some of my nowadays, you know, my research topics actually very close to Dr. Satria, because it's easier for me to get the data online during the COVID-19. So that's why I try to shift a little bit also to the macroeconomics, especially for the consumer behavior. But you know, if it's not the pandemic, you know, after the pandemic, I'll go back to my main domain, you know, like more into physical and cognitive perhaps. Okay. So we also talk about the safety culture. This is a part of macroergonomics. Okay, I will ask one of my PhD students. Actually, he will have one publication in very good journal of International Journal of Occupational Safety and Ergonomics. Yes, he actually worked in the Philippine power plant in Quezon province. Okay, in Quezon, there is one big power plant there. So he actually show like what will enhance the safety climate. Okay, we will talk about the safety culture and safety climate. Okay, it's not about climate change. Okay, this is safety climate. Okay, we will talk about this one on the last 2 weeks. Okay, in the beginning, usually I ask the student, hey, what do you think about safety climate? You know, oh, it's about climate change. No, I don't talk about the climate change in Ergo. You know, I talk about the climate of the safety climate. For example, okay. For example, you know, safety climate. I remember, you know, safety climate in the chemical engineering laboratory. Okay, they really have to have certain like climate. Otherwise, there will be disaster. You know, even in the chemical laboratory or civil engineering laboratory. Okay, for example, if you find a defect, for example, the statement is one: if I find a defect on the equipment, I will report it to the instructor. See, 1 to 5 Likert scale. You can try to check, what will enhance the safety climate. For example, another one. If I report this one to the instructor, I will get 100 pesos for reporting that one. Like that one. That's the incentive. Okay, to enhance the safety in the in the organizational in the workplace. Okay, those are the things that are very important. Okay, for us to be discussing here to enhance the safety climate. Or for example, I will feel very happy if I get the training about the evacuation something, the 1 to 5 and so on. So, but often is quite interesting that for me, almost before the pandemic, I was in Mapua for 10 months. Okay, then during the 10 months, I never experienced the fire. Our training or like a
Fire drill.
fire drill or like earthquake drill or anything. I mean, those are very important. Even we talk about
But
the yeah. Or just about next 2 weeks there will be seminar class. It will be about safety climate in barangay. See, even in barangay is very important. Like the fire happen almost every year. No, in the Philippines, I don't know, every 6 months perhaps you can see a big
maybe, Sir
fire.
Yogi, it just so happened that you don't have a class, or you really did not hear any news of a drill
I don't
during
know.
your time.
I don't know. But you
I
experience
think
it, right?
it should be
You had
it should be once a year. It should be at least
okay.
once a year.
I think
So
yeah. Okay, perhaps I don't
it's
know.
either there were none, or you don't have a class yet. It's usually in the morning
Really? Oh, okay.
around 9-10 a.m. before
Okay, perhaps.
lunchtime.
Okay,
Then it would end lunchtime. I think that's the reason why you didn't experience it.
okay. Yeah, usually I come at Mapua at 12 until 10 usually. William, I usually always be the last person who leave the Mapua. You know what? Don't you know that? Usually I went back at
And
11
he will tell us
I
scary stories before he leaves.
in Intramuros. Yeah, there's so many spirits. Okay, so like those things is actually quite important. Okay, enhancing the safety culture. Next 2 weeks there will be one expert, Dr. Ilma. She is actually an expert in safety culture. Okay, and then she will talk about very interesting. I was like, oh, safety culture in a communities, like safety culture in barangay. Wow, that's a very new term for me. I've never heard about that one, and I think that makes sense if there is a fire drill or of their barangay, there is a tsunami, and so on. That's actually quite important. Okay. And then, this is the thing that perhaps not many people like doing this one. Okay, this is the accident analysis and prevention. So after the accident, okay, what will happen? How we do this one, after the accident analysis. Okay, not many students like this topic because when you read this topic, you will feel like what you have to read the detail of the case, and sometimes it makes you uncomfortable. But this is I only did the injury. Okay, I published one injury, but in the past I did a fatal fall. So all the cases are dead cases. I have to read around 300 something cases, like the head split with the body. Like, oh, you read those sentences and so on, and you try to tabulate those things into more comprehensive statistical things, so you can do some kind of like prevention. What will happen? Yeah, we will talk this one in the week 8 or week 9 in detail. So sorry, I have to force everyone to experience this one. This is very useful. Okay. If someone dislike doing this one, we can do so many other topics like the fraud, the credit card fraud. There is a how we tabulate those things, or like there is students complain. We can do those things because I try to make something qualitative into very quantitative. Okay, this one. Okay, this is the idea how we make some kind of, for example, later on, what in the study, I realized that this one, employee status, is actually quite important. That usually the workers who had the problem is actually the third party. Okay, sorry, you had the accident, you see the third party, and usually they actually work less than 12 months and so on. Okay, so that's the thing that you need for us um, uh, to show these things. But of course, getting this data in the Philippines is actually quite difficult. Okay, getting this one in the Philippines. But I was quite lucky that one of my students working in the safety and health in his company, and then his company said like, oh, okay, as long as you don't mention the name of the company, then you can also do that kind of publication, and then you actually tell us what we need to do. So we actually read 185, but this is injuries. Okay, but the worst actually until amputation of extremities. Okay, so it's actually that there are some cases like that one, and then we try to tabulate. Okay, we did the first thing we needed to do the dummy coding. The age, the gender, this one. We did the frequency, simple frequency distribution. Okay, one by one. Okay, for like this one, and we tabulated this one activity, what activity during accident, the type of injury, the part of body injured, injury classification, and so on. So for one case. Remember, one case, one injury, or one death case, I have to classify into this. So many things like this one. I have to ask what time you work, which department, is it new, and then what kind of injury, which body part, and so what kind of activity he or she did, and so on. So for one case, I have to code, up to this one. See, the agent of injury, the location, the root cause, the direct cause, I have to classify those things one by one. Okay, now, and then we can get the result like this one. Okay, this is some kind of like a correlation, but this is correlation for nominal data. So that's why we utilize Kramer's fee. Okay, the Kramer's fee to see what will happen. For example, this is very interesting. Okay, for example, this one. Okay, gender, it has, for example, this one. Gender and employee type. Yes, this is significant, but is it important? No, not really important. But this one, gender with let's see, the type of this is actually, sorry, this is the root cause. Okay, so the gender and the root cause, there is a strong correlation of this one. Wow, what kind of gender and what kind of root cause? They actually, a typical thing that happens in here. Another one, this one, part of body injured. You know what? The part of the body injured. Later on, I know that a female, usually they have a problem with the extremities. You know what? With the extremities, I found it like that one, with the extremities and so on. And then another one, you know what? Female, actually, I found it like, I think agent of injury. Oh, agent of injury, not significant, part of body injured. I forget. The one that I
Location
found.
of accident.
The issue is something like this one. I remember that the female, usually they put the female workers actually more into chemical things, into the chemical related. So actually chemical is actually quite dangerous for women, especially they inhale. They actually accidentally inhale and they fell. Okay, they actually fell because they inhale some kind of chemical things, and they actually fell. If you fell, just fell on the floor, perhaps you only get sprain and so on. But you fell in the conveyor, what will happen? You know what? It's scary, and those things. Okay, so we will do these things. We will read one by one, and then later on we can do some kind of like this kind of analysis. Okay. The Kramer's fee, and then later on we will show the phi analysis to know like which one. For example, this one, gender and what kind of gender and what kind of root cause they actually correlate each other. Okay, so we can do this one in the week. Okay. Now in macro ergo, we also talk about this one. Okay, about like COVID-19. FUCA. Volatility, uncertainty, complexity, and ambiguity. Okay, this is a new term that is not new term. I would like to say a trending topic. You know what, a FUCA. I would like to do this kind of, mom often SEM with FUCA, just like surf qual. But now I would like to do like FUCA analysis. I mean, wow, can I do that? Every time we see like this one, wait there, you can try.
Sounds very new. Sounds
very new, right? I mean, FUCA analysis, yeah, we can do it. We can construct this one, but what's the object? It's up to us, we can do like a fire, COVID, or earthquake, and so on, If people in quality, they always do the surf wall, and so on. Why not I'll do like FUCA, analysis, perhaps that's wait there, we can try, if people dislike this one, it's okay. We can change the journal, and then if people like to buy our idea, then it's okay. I think it's very interesting. Puka analysis. And now, in macro ergo, we always talk about this one, sustainable development goals, and I think it's the same with I don't know, I think we are forced to do this one, right? In the research, I think yes, like belongs to
Yes,
which
but
one?
most especially for extension services.
Oh yeah, yeah, yeah. So we actually try to see, but I think what, all the thesis in IU, it can go, it goes to one or at least one. We can always put into this one, the sustainable development goal. But the one that I did so far in macro ergo is about good health and well-being, affordable cleaner energy, and climate action. I only have the experience dealing with these three, but I would like to do this one, life below water. I like water, but I'm not from environmental engineer. Perhaps this is Ma'am Delia's world, not my world. I know, but somehow I would like to do about that one. This is what I did. Okay, I try to summarize some of my studies in cognitive and macroeconomics during the COVID-19. So even during the COVID-19, we can still do many publications, even just using the online questionnaire. Okay, it depends on what is the topic. So this is the disaster management cycle. A part of macro ergo, we can also do the ergonomics in the disaster management. Okay, and this is the cycle. Every time when there is a disaster, you can actually make into the cycle, the preparation, and yeah, that happens. And after that, after it happens, you do the response, just like Taal. And after that, you do the recovery. After the recovery, you do the mitigation. After mitigation, you will know something will happen, almost will happen. You prepare, then it happens again, and so on. So this is a kind of like a cycle that you need to do. So that's why every time when there is a natural disaster, for example, typhoon and so on in the Philippines, okay, either I do the study before the typhoon or after the typhoon, or before the big one, before it happens, or after it happens, just like the Taal. Okay, Taal happens, and then I did one study, although the model was very, I know Mom often later on will laugh, oh my god, the model is so simple and so on, but the idea is like you are the first person to talk about that disaster. So every time
Is
when
this
there
the
is a
work
disaster,
of Yoshi? Is it for
yes,
Yoshi?
yes, yes. Yeah, it's very simple. And then even when I saw that one, you know what, Maela just laugh like, oh my god, that's so simple. Like, yeah, you know what, at the beginning it was just a final exam of the research method class, and then by two of undergraduate students, but I asked Yoshiki to, hey, you want, this one, because nobody talk about this one. And then after the day, the data, I mean, after collecting the data, nothing you can do, right, Mom? I mean, nothing you can do with the model and so on. So you just have to accept it and try your luck. And then the revisions, you know what? I think one reviewer up to 20 pages. It was my record, but they did not reject it because they actually know that okay, you are the first person to talk about Taal eruption, in 2020. So they did not reject it only because that one, but the model. So that's like one of my friends also told me like, oh my god, this is you, I'm like that one. And I say like, hey, yeah, I know, what, but don't worry, after this one I will publish a little bit more I was like to say better, compared to that one. But I did one after the response. What will happen next is actually this one, right? Recovery and mitigation. But I think now it's actually in the part of the mitigation or preparation, because Taal will perhaps erupt again, soon. So I actually have one study under review, okay, related to the preparedness of another explosion. So that is the continuity of the study, okay. Or another one, just like Ma'am Gumasing's paper, is about Typhoon Jolina. It's actually under review. So that's why when there was a typhoon, I forced her, hey, 3 days, come on, let's make a data collection 3 days before that one, because if it's typhoon after, you know what, I have one study. Yoshiki did the study about Vamco. It was a very big, the biggest, in 2020, the biggest typhoon in 2020 is the Vamco. Okay, so if I conduct that study, that typical typhoon after the incident, perhaps the novelty is not that new. So that's why I forced, hey, it's still different. You know what? The difference is actually the preparedness and the response are two different terms. And people in the disaster, they know. They know. It's like after the disaster or before the disaster, or just the mitigation and or the recovery period. It's actually quite different. The term itself is actually already it's novel, it's new. Okay, so I did study about the big one earthquake. This is the Artvin is actually his PhD dissertation is about this one, but he also did more data mining with this one with the data collection. Okay, and then another one I did a study about it's still happening right exactly right now about related to the COVID. I did a study about the eruption after the eruption. Okay, and then this is the vulnerability. Mom often seems this is here in this topic in this paper too in the vulnerability in this one in Marinduque. And then another one is actually I don't know. I don't say this one a disaster, but I just put it in here, as a mitigation, perhaps what will happen with the Bataan nuclear power plant because you know this one, Bataan nuclear power plant is the only power plant in the Southeast Asia, and then it's sobrang sayang that well, we don't use that one, right? In here, and then if no one published this one, then I'll be the one who published about Bataan. Try to see how people accept it. How accept it, and the result is very interesting actually. So try every time when there is a disaster, there is an opportunity that we can do. Okay, that's the thing. We need to think. If yes, 30 years ago there was a big tsunami, the night killer in Mindanao, the tsunami. I don't know, 30 years ago or 40 years ago. I think yeah, around. It's the silent killer. I forget what was the name, but Indonesia 2 years ago we had two tsunami. Two. It's not just even one. Okay, it two in very totally very different island. One in Sulawesi and another one in the western of Java. Okay, and then and soon what I think they will be predicted in the southern Java there will be another tsunami and so on. Okay, so yeah. That's the thing. If every time when there is a disaster, there is some kind of an opportunity or the thing that we can do. Okay. Okay. Oh, another one. This is just this is not my study, but I would like to share this one. In Ergo, okay, when we do a human, either we do a routine task or non-routine task. Okay, this is actually someone asked me, for example, sir, do you agree with the Tesla with the autonomous driving and so on? And then some people, William, you want it? You want autonomous driving?
No, sir.
Yes or no and so on. But sometimes then someone asks me like, oh, autonomous driving. Do you want an autonomous plane? Plane without pilot. I think that sounds good. Plane without pilot. It will be much cheaper. Perhaps it's only 1,000 pesos. Perhaps I can go to Coron every day. I say like that one. I mean, and they say like, someone asked me like, oh, Tesla sounds nice. It's like, yeah, it's good. Autonomous driving and so on. But why you disagree with autonomous plane? If there is isn't it more safer flying there? It's fine. It's like, oh no, sir. If there is a rainy thunderstorm and so on, see, that is what I call non-routine tasks. In a non-routine task, you will face either the normal non-routine, but it's with the SOP or emergency. They actually well trained. Human actually well trained for this one. You know what? This one, yes, routine tasks you can make it into AI, into the machine, but the human is actually will have. Will be useful in this one non-routine task. And in here, you know what? Yeah, human will be trained with the SOP, but what will happen with the abnormal, purely abnormal? Human is actually the only one that can deal with those things, and human will make a decision out of that one. So that's why there's a knowledge-based behavior and problem solving is actually quite new. For example, dealing with the COVID-19, what is the SOP of COVID-19 and routine task? It's very new, something new. Delta variant, for example. Okay, there is a SOP and so on, but another one, there is another like super abnormal condition, right? Just exactly like right now, the Delta variant, Delta plus, and so on. It becomes getting scarier and so on. So those are the things when human can, you make an impact on those systems. Okay, how many hours? I already talk for so long. Okay, this is still half, okay, everyone, but don't worry. Let's just have fun. If you would like to drink water, if you want to have fun, like a stretch and so on, it's fine. Okay. Okay. Uh, let's just stress a bit and then stretch a bit, and then we go to the two things. I've done some studies related to the cognitive and macroergonomics. Okay. Because in the physical ergonomics, I will explain to everyone that at this point, you know what, I would like to say the equipment for our equipment is actually, we have to compete, competing with the top physical ergo researchers quite difficult if we do not have those equipment. So, and another thing that perhaps I'm more interested in the cognitive and macro. So this is some examples that I've done in the cognitive and macro, but hopefully after COVID-19, I'll go back to the physical ergo. Now, this is the study by William. Do you know two of them? No, or different batch, they are too old. Lance and Naomi.
I do not know them, sir.
Sure, it's from undergrad.
Yes, this is undergrad. This is undergrad thesis. I'm their thesis advisor. My first undergraduate student, actually, two of them. So at the beginning, I asked them like, "Wow, you come to me. You're so brave. You want to die and so on, And then they said like, "Oh, sir, it's okay, and so on." This study, I spent around. It's mahal. I spent 20,000 pesos for this study because this one, you know what? I force the human to perform. That's the difficult part in the. So I need to pay them, and so on, and not just support that, and then the programming and so on. That's the thing that quite challenging in cognitive ergonomics is actually that the software should be the same, the computer, and then so many control things in the experiment, because this is experiment, so that's why so many control variables and so on. But glad that they actually create 3 studies, and then this is actually one of those, but this is not their best. Actually, their best is actually Maela is actually still finalizing that one. It's actually more I would say much better than this one. Okay. This one, it's very simple. Actually, they try to collect, I would like to say, at the beginning, when I see this one, when I see the pamphlet or a poster about the COVID-19, you always see this one, the icon. You always see the icon. If there is an icon, this is a graphical things, so if there is an icon, then I can do ergo study, for example, what is this icon? Open window, okay, keep ventilated, okay, and so on. For example, this one, what is this? What's the difference between this lady and this guy? William, what do you think about these two? Same, right? Perhaps that you will say like, I think that's
Similar, sir.
yeah, that's quite similar and so on, and so on. Okay, so and this is from WHO, even from WHO. What do you think with this one? Water, drink water. Okay, what is this? Oh, this is separate. But if you see this one without this explanation, what is this? Like mirror? I don't know. I don't get it. So
Spot the difference.
it's like find a difference. Like, okay, so basically, this is even from WHO. I feel like, really, okay, there is something I can do for that one. Okay, look at this one. For example, this one, paano maiiwasan ang sakit dulot ng coronavirus? When you see this one, if without this one, what do you think about this one, William? Without no.
Animals are not allowed.
Well, Mom Offit, what is this? What do you mean this one?
The same. No eating of pork and chicken, and animals are not allowed.
Diba? See? See? When you see this one, I'll be like, and this is from DOH. I'm thinking like, wow, from DOH, there's something very unique there. Or this one. This one, William, what is this? What do you think about this?
It's so smooth, sir. I cannot actually.
Mom Offin, what is this?
Stomach ache.
Yeah, same.
Because it's in the lower abdomen. It's in the abdomen. Not here.
Yeah, it's not here. It's here. So when I see this one, I feel like, wow, why is like that one? good. You know what? You have this. You have this word. But if without this word, what people think with this one? You know, like oh, then there must be a thing that I can do with the graphical things. This is visual display.
I think it's supposed to be diarrhea because remember diarrhea
Yeah.
is one of the
Yes. Yes.
and then
yes.
they accidentally put in hirap sa paghinga.
That's why. That's why, you know. But very interesting. Like for me, very interesting. These two. This is very interesting. Like why is this thing? Like so let's just eat what? Eat beef, something like that one. You know, like or what? Eat fish. You know, like I don't know. I'm thinking about that one. Okay. So this one, this is actually their second study, additional study. Actually, this one actually the main thesis. It was not this one. Still finalizing, but this is their second study. But it was just coincidence. It's not coincidence. I would like to say, this one is much easier than the first one. The first one is it's difficult, you know, to well they finish it, but in order to make it like a journal level, I cannot force them even more because they almost cried. Every time we do, we like, sir, we want to graduate and so on. I mean, like we already more than enough. Yeah, I know, but I told them, hey, I spent 20,000 for that one. You know, I would like to collect more, but yeah, eventually that they did very great study. So they collected 133 existing icons. So this is actually existing icons, okay, and they would like to see how we actually, evaluate it. Just evaluate it. You know what? Using a simple subjective rating. Now, 133 is actually from several different functions. I think they have 19 functions. Okay, so 19 times 7, so it's going to be 133. Yeah, correct. So there are 19 functions. For example, wash hand is actually one function. Okay, so I have several different functions: wash hand, social distancing, any other functions. So call the doctors and so on. They have functions. And for what function, they actually I forced them like, can you find 7? They said, why 7, sir? It's okay, or like 8 or 9, up to you. Just why don't we just set into 7? That's fine. It's okay. Let's just find 7, and we try to ask people which one they like. Which one they like. For example, this 7, 1, 2, 3, 4, 5, 6, 7. So this one, you know what? I used the HTML, so I actually paid the website. I recruit. That time I know the difficulty from experimental cognitive ergonomics is actually about the coding. So I told them, hey, it's okay, find someone from electrical engineering or computer science. I pay that, just tell them our interface and then what we would like to measure, and then they know, doing this one for them is just 2 hours work, and then we just pay them, and then we try to collect this one to the human. Okay, so now we actually recruited 57, and then this is actually online. So I make kind of like online experiment. Okay, and then it works. Actually, people actually the reviewer appreciated this one. Wow, you actually did the online experiment and so on. But in here, I only measure the preference. Like I'm not measuring the completion time, the accuracy. If it's about accuracy, then the size of the size of the display will be, will have an effect. The mouse will have an effect. The CPU will have the effect, and so on. If I measure the accuracy and movement time, but this one I only measure the preference. I don't care about how many seconds you finish the task. I don't care the accuracy and so on. I just want to know which one you like and why you like. That's all. As simple as that. Okay. So later on, for example, among this one, which one you like, William? Which one you like?
Sir, the upper left side.
This one?
Yes, sir.
Mom Offin, which one you like?
The same.
Okay, this one, right? This one that you like the most, right? And after you click this one as the number 1, let's say this is number 2, and so on, you actually measure using the subjective rating scale, or this is actually the semantic scale. Okay, why this one, like likable or what? Ugly, beautiful, ineffective, effective, vague, clear, weak, strong. This is actually the Kanse words, Kanse engineering. What do you feel when you see this one? Okay, the semantic skills. Okay, and so on. This one, two of you say this one is number 1, right? The best one, right? Let's see. Yeah, it's ranked number 1. The majority from 57. See, this is ranked number 1. See, they actually, the average score, if the lower is actually the better, right? The ranking, right? The ranking 1, 2, 3, 4, 5, 6, 7, right? But people say, hey, if it's ranking, don't use the mean. I was like, yeah, it's correct. If ranking, don't use the mean. But this is the BS work. So they use the mean in here. They just, sir, this is the ugliest. This is the best. Yes, I know, but you only use the ranking as the mean and like that one. It looks so weird for me, but it's okay. This is actually people like the most. Yes. See, two of you like this one, like the same with all the 57 participants. It makes sense, diba? Yeah, it makes sense. This is number 7. For the function, this one. For the function, this one. Wash hands, okay? And then the worst is actually this one. For this function, okay? This is actually the majority, okay? Or like this one, consult with doctor. See, this is maganda, right? Yeah, people nice. What about this one? Sushi? You sell sushi or what? Or what is this? Huawei? Promotion or what? I mean, it makes sense, diba? I mean, ergo is always just about sense, like eventually, but you just prove it into mathematical model with or statistical things, everything is about the sense, ergo, But for when I see this one, yes, of course, it makes sense. People don't like this one. What is this Huawei promotion or what, And what is this sushi? It looks like a sushi seller for me. Like, yeah, people don't like that one, right? Makes sense. Yeah, it makes sense, So, but the goal in here, I cannot tell people why this one is actually, the best one, why this one is not the best one. That is the limitation of this study. I only can show which one is the best, and then what people feel about that best. That's all. What I can do for this experiment. I cannot show the feature, this one, because I did not test the feature. Now that is another study. They actually did a feature analysis, so they can have a guidelines, some kind of like very nice guidelines to make a very nice I would like to say icon for the public health, sorry, for this one, okay, for the health communication, okay. So this is actually I would like to see the correlations, okay, between the ranking and the subjective rating, okay. So of course it will be negative, because the ranking, like the lower the ranking, the higher the, for example, likability. If it is 7, the ranking will be 1, perhaps, because you like it. Yeah, that's why they have a negative result like this one, okay. But the most important is not like that one, but the most important is like is this good? They actually ask me, is this semantic is good or not? That's another contribution. If you can, for example, just like COVID, COVID-19, in the past, you have the test from the blood, you have test from the, whatever that is. If you have a better test, which one is actually a better test to, to show people? That's actually the thing that I would like to suggest, okay, to the ergo researchers that like to do this kind of study, can't say engineering, okay. But that one, they actually don't satisfy with this one. I don't like the Spearman correlation. If you just only correlate this one as this one, I don't like that one. I would like to know, the true difference, what for each function. This is actually from all function. I don't care about the function. Okay, I just put everything into one table and then like this correlate and so on. But they say, no. I would like to see per function, to really show that it actually works. Okay, but of course, if you see per function, some yes, some no. Actually, you can see like some function they actually have a nice semantics. Some actually they have not, and so on. And then I just show this one, and they actually quite enough for them. It's like, oh yeah, this is actually very beautiful. Don't worry, doing this, I will show in the 3rd week, okay, during the visual display. Doing this one, oh, it took me a lot of. It's not difficult. It's just repetitive work, counting one by one and so on. Okay, so in here, I would like to see which semantic actually quite powerful. Okay, to show what that is actually good or not. So in this is actually I use the Friedman test. So in cognitive ergo, we also talk about this one, but I think Ma'am Ofi knows about this one a lot from the Dr. Satya's class. William, don't worry. After this one, you will study about multivariate, but I think Dr. Satya will explain many things about structural equation modeling and smart and the PLS also. He will also talk about this one, so you will know what is this, and so on. But this one actually created by MEPIE, ma'am. But look at that one. How many? It's very simple actually. 1, 2, 3. Only 3. instructor characteristic, performance expectancy, and learning value will affect the e-learning platform. But this is for medical student, medical education. Okay,
Sir,
so
what does the broken line mean?
not significant. It's low, like the factor loading is low.
Oh,
So this is actually low. Yeah. But this is actually high, like the beta coefficients, it's actually quite good. So this is the one that I found in the study. But I think why this one got accepted, I think just because this one medical education, the target, the target is actually like that one. Okay, new. I would like to say for them perhaps it's quite powerful, so they actually appreciate from that one. The model is actually just so, if you see the model. This is the done by the senior high, but Artin actually helped me to finish this study. It's just another one in cognitive ergo that we will use about the ETAM and also the Lon McLean I success model. Don't worry, we will talk about this one during the usability. The third week we will talk about the usability in this one. We will talk also about no, I don't talk about this one a lot, but we can also do a conjoint analysis. Mom Ofin, don't you want to try conjoint? No, yes. Pwede, I mean, can be if you
let
like.
me learn it first.
But you got a little bit the concept, right, of the conjoint. I think you have the concept.
Very, very not clear yet.
Not clear yet. Oh, okay, don't worry.
Not clear.
William, do you know conjoint? No, of course.
Not yet, sir.
Not yet. Okay. Conjoint usually is in the multivariate. Yes, is the last stage of the some BS they will study that, some no. But in MS perhaps you need to learn about the conjoint. But don't worry, you will learn from Dr. Satya about the conjoint. Okay. So let me skip this one. Don't worry. But this result, right, Mom Ofin, right? It's very interesting that for BS they like.
You presented this, right?
Yeah,
To
yeah.
us?
I presented this one during the I forget what's the OBE. Yeah, OBE competition. Yeah, OBE competition. But OBE, I mean the competition is just the competition, but the one that I won, of course, to publish that one in a journal. So it took 4 months after the competition, then we actually finished this one. But they actually accepted quite fast, for this one. They actually like to see this one. Like, wow, you show that the people actually, even in IE, they have different preferences. Okay, for this one. Okay. Now I would like to go to the sum in the macro ergonomics. Okay. I would like to talk about the COVID-19 and the disaster risk reduction. Okay. For my publication. Oh, this one is actually like a. Do you know them, William? I think they're famous. You know, Seneta. You know Seneta, right? The basketball player. Yeah. Okay. So this is actually their FTI. So it's very funny that after my class, during my class, they actually had 2 studies, but the model was simple, and then they say like, oh sir, it's COVID, whether we do another study. Okay, but eventually, you know what, in my career, this is my best publication. It's very weird that even my professor told me that, hey, how come your best publication is not ergo, it's macro ergo, but it's very public health. And so like I don't know, professor, it's just coincidence, that it happens to be like that. Okay, this is the model. Actually, it's very simple. Actually, no, it's very simple. The concept is very simple. When you know about coffee, okay, you will feel vulnerable and you feel severe. You feel like, oh, it's dangerous and so on. Okay, then it goes to you to some kind of like this is the theory of planned behavior. Okay, you can go to certain behavior, it go to your adaptive behavior and your real behavior, and you will feel whether it's effective or not, the prevention measures. As simple as that one, the idea. Okay, so if someone does not believe with the COVID, of course he or she will not feel the prevention measures is good, because you don't believe, then you don't feel that it's severe, you don't feel that you're vulnerable and so on. Okay, so this one actually I applied this one into so many, this concept into like typhoon, the big one earthquake, the Taal volcano eruption, and so on. So I combine several theories, 2 theories: is protection motivation theory, because when you know something a threat, it goes to, for you to a certain behavior, right? The protective behavior, okay? For example, pedophilia or like so on, or like then you can combine it with the theory of planned behavior. Don't worry, William. I will talk about this one during the usability weekly. Okay. The good thing in the Philippines, Facebook can collect so many data in a quick period. Okay. 4 days, I collected 649. But I don't know. You can ask Seneta how he did it. I think he was the one who asked everybody. It's like, hey, come on. I mean, like,
Maybe the whole of IE community
yeah,
was given the questionnaire.
yeah, I think only 4 days, ma'am. So it's 649. So every time when my master gives me, oh, sir, I have no blah blah blah, and so on, I thought like, hey, you know what? This is the BS. Then they only 4 days, they got 600 something. You know what? It's like, perhaps you, and this is only for the purposive sampling. Purposive convenience sampling, not purposive sampling. You know what? If purposive sampling, it'll be more difficult. Of course, this is just convenience. You can put it everywhere. Like,
Mine took 1 week for 400 respondents.
see, it's not that difficult, right? I mean, yeah, I mean that's the quick one. That's why, like, nowadays, I somehow feel want to shift into into this this world, because the data collection is actually free. Not like cognitive ergo, right? I mean, that one is like experiment. I have to decide this. So yeah, somehow I feel like well, but some people also ask, hey, you change direction, yeah. So I also show some like, hey, I still can publish my own, expertise, but now I feel it's so tempting to see, to do this kind of study, cross sectional, and so on. So it consists 63 questions, okay, and then you can see several latent variables in here, and in the study. But the story is actually very simple. That when you understand, you feel vulnerable and severe. After that, it goes you to a certain behavior, and after that, you will feel, oh, it's actually a good, or you perceive it as effective. Okay, but one interesting finding that I would like to highlight in here is like this one: understanding of COVID-19. It's actually will lead you to what? To this one, perceived effectiveness indirectly. Okay, so when you more understand about what is COVID, you read about what is COVID, you keep updating your knowledge about COVID, somehow it goes to your perceived effectiveness, but indirect. Okay, so that is the thing that I would like to tell people. But this is before the Delta, okay? But after the Delta, I don't know what will happen. Perhaps we can compare with the Delta period, okay? But I don't know, in here, we've done with the Delta, ma'am. We're done. In the Philippines, I think it's slowing, getting, slowing, flattening, and so on. But in Europe, no, it's so scary. In Europe, they just started, especially in the Eastern Europe, okay? In the Russia, like 1,000 people dead every day. And then Ukraine, they just started dealing with the Delta, okay? So the country that, like India, Indonesia, we've done, with the Delta, but those countries in Eastern Europe, they just started with the Delta. Then it's very different. So this is the findings. Okay, so when you understand COVID, it goes to the protection motivation theory. Protection motivation theory go to TPB. And this one very interesting, that the understanding of COVID-19 had a significant effect on perceived effectiveness. But this one is indirect. That is the thing that I highlighted. So, but this one actually, my most cited paper so far during my academic career is this one, this publication. I don't know why, but people in doing something related to the health is actually quite quick, so I'm trying to apply ergo in the health too, so that's why. Okay, this is the macro in the disaster management cycle. Okay, since the Philippines is always, we always experience so many different disasters. Okay, so when there is a disaster, or like when we prepare about for a disaster, that's why I would like to make a publication about it, because I would like to say, if other countries, they have adequate equipment, advanced equipment, and so on, so I will try to see, what the Philippines, what we have, okay, what can we do with our study, okay. But I realized that, wow, in here is a disaster prone countries. Then if a disaster prone countries, then I should be the one who think about what ergo people can do in the ergo based, or macro ergonomic based in the disaster management. So that is the thing that I would like to do. No one is actually doing that one. For example, if someone has, someone published about the community vulnerability. Can I do like ergo-based vulnerability? Can I do that? Yes, I can do that too, right? Mom, often imagine you do a vulnerability based on that one. Okay, physical, cognitive, and macro, and it goes at the beginning like vulnerability, ergo-based vulnerability. Oh, that's a very interesting study, and you make it like related to the flawed, to so many things. Physical can be flawed, can be so many things. Cognitive can be depression, mental workload. In that one you measure in that area. Macroergonomics can be about the economy, can be about the the job design and so on, or the workplace environment, and so on. So, or like a incentive or the safety in the barangay and so on, and then you combine all together in ergo-based vulnerability. Wow, that's a very nice. Or another one is actually sustainability. Okay, ergo-based sustainability. Oh, that's a very nice topic. My professor is doing that one too, so we are competing each other. Ergo-based sustainability. I have 10 more slides. So okay, this is actually the Taal. Okay, so it's actually written by these two girls. Do you know them, William? No. I think they're famous.
Miss Anthony.
No.
I know
You don't know
Miss
them?
Anthony.
Okay, you know one. Okay, yeah, she's famous actually. Yeah, she's famous. So actually, two of them, and then they actually collected the data about the Taal. Okay, and then so yeah, we actually collect the data, but yeah, mom often is this only this one.
I think I answered in this survey,
Yeah, so this is
but
actually very.
I just responded as if I'm from Pampanga, but I'm from Bulacan.
So this one is actually like a very simple. Only ask the damage, the evacuation characteristic, eruption characteristics. That's all. And then this one is not built on any theories and so on. Like not like any basis. They just put everything that they think that I mean, and the response actually is very good. For example, PS1, if you read the paper, it's something like, oh, I will go to Taal because I want to see the eruption. I'm like, what kind of indicator like that one? Like, I because it was just for final exam. I said, it's okay, it's fine. But now I realized that wow, that's a good topic. Actually, it's just the model is very not good. So, but very happy that Yoshiki wanted to sacrifice to make the paper safe, and then he actually sacrifice also to enter the 20 pages of the comments. So and so on, but eventually we published that one. So now he will do his paper. Another one about Taal volcano eruption was preparedness is actually still with editor or under review. I think I have submitted that one already, but that one is actually quite good. Okay, this is the Artfin's PhD dissertation. Actually, he wants to do the big one. Okay, the big one earthquake. So before actually the incidents. Okay, about the big one. But I think the big one. We have to be prepared very soon, because I think last 2 months there was a big earthquake in Cavite, right? 5 or 6. Yeah, I think a very big. In Cavite. But so if it's around that one, then it's gonna be soon. We have to prepare about the real big one that being predicted. Okay. So the same almost the here, the perceived vulnerability and then perceived severity. This one I put it this one. Okay, it goes to the theory of planned behavior, but this one is only for this one, intention to prepare, because it's not happened yet. So it's only like what factors will enhance this one. Okay, but I add the power of the media. That is actually very interesting. And another one, you can put the government related. Yoshiki put one paper, one Latin is actually government support or government related. We can also put it in the model. The one that he published in the VAMCO, he put geographical perspective. That's very, very interesting. He also put me like geographical perspective. For example, people in Mindanao perhaps it's not really that not that big, but people in Manila, yes, perhaps the geographical perspective will lead to intention to prepare. Wow, that's very interesting. Another one, he showed the government response or something. So yeah, another thing. Oh, this is about the consumer behavior, okay, that I did. Okay, basically for the conjoint, everyone, this is a study about conjoint. This is consumer behavior, okay? Some part of the macro ergo is about consumer behavior, okay? So in conjoint analysis, okay, William, okay, for example, you have to know these two things, attributes and the levels, okay? Attributes is like variable, like what you know, but in conjoint we call it attributes. We don't call it variable. Very strange. People call it variable in conjoint. People usually call it attributes. Okay, and this one is actually the level under those attributes. Okay, so if you want to buy milk tea like this one, you will consider this one like pearl size, sugar level, price, brand, the type, cream cheese, amount of ice, or perhaps you have even more. Okay, but usually people can evaluate 7 at the same time, because if you add more and more and more, you know, it will be difficult for you to evaluate that one. So I put it into 7 only, and then this is I decided the levels by brainstorming and then checking the real in the field. So this is I decided this one as the study. So if you would like to do any kind of conjoint is good for market analysis, okay, for market research, okay. So later on you will know which one is the best combination, and not only the best combination, you will know how big the percentage of this one. People care about what the most, you know. You can show this one, you know, you can get the result in here. They collected 1,000 respondents, and this is actually 1 week. Also, you know what they only collected 1 week. This is the senior high. I mean, what the senior high can do, right? I mean, they cannot do any difficult topics, you know, but they can do even just these simple topics. They can publish in a Q1 too. Very good SEI journal. Food is a very top SEI journals. And then this is the demographics, okay? And then this is how we actually make the data collection. Forget about this one. Forget about total and rate. Just this one. Combination up to this one. Read this one. Okay. So conjoin is actually from the, you know, conjoin. It's like you actually make the evaluation of something that they combine together. For example, this one. Small pearl, no sugar, 150 pesos. Macau Imperial, fruity with cream cheese. Fruity with cream cheese sounds there. Okay, and then less ice, you know. 1 to 7. William, answer me. 1 to 7.
Is there 3 or
3.
4?
Okay, 3. Okay, 3. Now this one, big pearl, less sugar, 150 pesos. Gongcha, milk tea with cream cheese, no ice. 1 to 7.
6, sir.
Okay, it's something like that one. Okay, so conjoin is something like that one. Okay, and
So,
later
sir,
on,
it means that me as a respondent, I will answer
simultaneously
12.
together. Yes.
Oh, okay.
Yeah.
But right away, I could see the combinations like this.
Yes.
Okay.
Yes. But that's why, you know, if you have more than 7, it's so difficult. Like, oh my God, so many. I cannot decide. 1 to 7 is still difficult for me. But 1 to 7 like this one, somehow you feel like, you can imagine that one and like, oh, 1 to 7, 6, 1, 2, and so on. So this is how we, collect the data in the conjoint analysis. Okay, the data collection up to you. 1 to 7 different scale, 1 to 10, 1 to 100. People like, but I use 1 to 7, just 7-point different scale. Okay, it's up to us. Okay, and this combination, you know what? I will talk about this one not today. Okay, how more in details about conjoin. I just introduce everyone this technique. Okay, this is like this one. This is the data collection like this one in the Google Doc. Okay, is Hindi Maganda. I know, and some people told me, hey, this is Hindi Maganda. Yes, I know, but how can we make it Maganda? You know, this is yeah, I don't know how to.
Maybe
Yeah.
just add a picture of the milk tea.
But mahirap, ma'am. For example, like
Kasi this is a Google Doc only.
yeah, it's mahirap. So yeah, so I feel like, yeah, it's okay. You know, one of the reviewers actually told me that this is not a good one, but I do understand that you actually tried your best, but the best one is actually you have to give exactly this one to the respondent. Not like, hey, 1,000 respondent and I have to buy, one respondent, you have to evaluate 34. So I have to give you 34 for one respondent. Oh, I'm not that rich. Giving like
and then it will become experiment. experimental.
Yeah, it will be experimental
Right.
like that one. Very experimental if it's like that one. So yeah, this is just market analysis. Conjoin is good for market analysis to know what the market wants. Okay? Okay, this is the result. The pearl is actually the most important, 29%, so almost one third. That yeah, it makes sense in the Philippines. So people like the pearl, okay. And then the second most important is the sugar level. I think it makes sense because it's milk tea. Okay, if it's not sugar, then what you know what? But very interesting is this one, bread. People don't really care. It's just only 2%. You know, only 2%. You know, so it means that there is, if you would like to make you know what, a new milk tea shop, then it's still a big, you know, a good, yeah, a good choice that the people, the bread is only 2%. So if you are a businessman, when you see this one, wow, it's a very big opportunity. Come on, from 1,000, you know, that's a lot, you know. And then the respondents is actually the Generation Z, mostly Generation Z. Okay, and then wow, if it's like that one, then this is a big chance for. And then you know that the pearl is very important. Then all of your you know what, the drinks should have the pearl, you know, and you know, and so on. And you can see, okay, see people like big pearls, small pearls still positive, people still like it, okay, but no pearl, see, it's minus. You know what, this is the utility estimates, this is the feeling, okay. If it's the if you have no pearls, then it'll be big minus. Okay, sugar, they like normal sugar. Oh, okay, more sugar still positive, but less sugar is already negative, and no sugar even worse. Yeah, milk tea no sugar is, but I like milk tea no sugar, it's very weird.
But
It's
sir,
healthy.
your respondents are mostly young people, right?
Yes, yes, yes.
Because if the respondents would be like us, it will be less
Yeah.
sugar.
Yes, yes, I know. It makes sense. Yeah, it makes sense. Yeah. Again, the demographic, we know the demographic, right? That's why this one, see, 15 to 24, 890 something. See, this is actually very small percentage compared to this one. This is so big, 84%. Okay. Okay, so this is Gongcha is the most important, but still 0. This is very small, right? Compared to, like, you know, the other one. You know, this is the other things. For example, this is 0.330 compared to this is very small. That's why the pearl is very important, right? The utility estimate track and so on. Cream cheese, yeah, people like cream cheese. The ice, people just like the normal ice. Oh, okay. Okay, so this is actually the findings. Okay. Okay. So now here is the my last slide. Okay. So in Ergo, start the thing that you like to, you know, the passionate about. There are three. Again, Ergo is always start with those three, but even those three, Ergo is a never-ending journey. So my professor told me Ergo is never-ending journey, you know. So they're always, you know, you optimize about human and so on. But now, you know what, Ergo in Europe, they talk about the drone. Ergo in the drone. I'm like, wow, yeah, that's the thing that what people are doing. You know, soon, you know, we will not use car anymore. We will use the drone. You know what? I think yes, it makes sense. In the next 10 or 15 years, I think yes. You know what? Soon people will not use the car anymore. People will fly, you know, to commute. Okay. So start with something that you are passionate about. Okay, so up to you. Okay, we can do many things. For example, mom often wants to, hey, is it okay to do like macro ergo in circular supply chain? Yeah, it makes sense. That's a good topic too. You know what, William, what's your hobby?
Sir, sports and watching documentaries.
What sport?
Volleyball, sir.
Wow. Why volleyball? Okay, okay, so you like volleyball. Okay, but you can also you know what, determine the trends after that one, after you like what topic. For example, the trend right now, what is the trend in 2021? The topic, of course, definitely about COVID-19, online things and so on. But even so, perhaps there is a thing that you know, for example, natural disaster. Okay, I don't know, no, no one published about tsunami in the Philippines. You know what, nowadays, Mom Offin, you know, when I tried about tsunami preparedness, okay, yes, I know last time happened tsunami. The big one is actually in the Mindanao, and then I heard one too in Mindoro. There was one tsunami, but actually many years ago. But that's still a good topic, you know, the tsunami preparedness. Okay, and then oh yeah, advisor is actually important too. Okay. I agree with that. The advisor is actually very important too. So don't worry. You know what? In PHCIE, all of us, we are happy people and we are supportive and we try to make everyone graduate on time. But even so, competing with those people, out there is actually very challenging. But we will try our best and then just like do it. Okay, just do it. Don't just think too much about what's the topic and then you just do it. Okay. So that's all for the. Oh, it's 2 hours. Almost. That's why I lost my voice.
Sir, I have a question about the
question?
conjoint. What
Okay,
tool
conjoint.
did you use? SEM?
No, conjoin is conjoin. The name is
Oh,
conjoin.
it's different. It's a different.
It's a multivariate technique. It's conjoin. The name is conjoin.
Okay. So I thought you can work
No.
on conjoint using SEM or
No,
other-
no, it's two different
Okay,
things.
so it's a different. Okay.
Yeah, two different things. The conjoin and SEM.
Okay.
Okay.